May is Stroke Awareness Month, and according to the Center for Disease Control, nearly 800,000 people in the U.S. have a stroke each year. Here to talk about stroke prevention and how to identify the symptoms of a stroke is Neuro Hospitalist with Baptist Medical Group, Dr. Rosella. Good morning, Dr. Rosella. Thank you so much for joining us.
Good morning, Rachel.
Well, first things first, tell us a little bit about yourself and how you got into neuro. You're a neuro hospitalist. I practiced that so many times, I still can't get it right, but hospitalist.
That's okay. Well, I've been here locally practicing in the area for almost 7 years now. And as a neurologist, it means that I specialize in conditions that affect your brain and your nervous system. But I specialize in just hospital work. And that means that I'm the type of neurologist who specializes in acute problems, things that you have to be hospitalized for. That would include strokes, seizures, cerebral hemorrhage, traumatic brain injuries, and things like that. But my main focus and the part I'm most passionate about is stroke, which is why I'm here.
Well, we're glad you are here. And of course, it seems like a stroke is something we tend to be pretty familiar with, or we think we're familiar with. But can you tell us or help us define what is a stroke?
Well, a stroke is an area of injury to a part of your brain that is caused by interruption of the blood flow. Now, most of my patients seem to assume that that always means a blood clot, but that's not true. Actually, it's much more common that it would be caused by a condition we call hardening of the arteries. In this case, hardening of the arteries of your brain, or cerebral atherosclerosis, which is by far our most common problem and one that is actually preventable.
Well, what was that word that you just said? What?
Cerebral atherosclerosis.
I'm so glad you're responsible for saying that, because clearly I can't even say your title, so thank you. But what are some of the common risk factors for stroke?
Well, when we talk about stroke risk factors, we like to talk about the big five. And they are a family history, not just of stroke, but of any conditions related to hardening of the arteries. Now, that's the condition, or that's the risk factor that you can't necessarily control because you didn't get to pick your parents. But the other risk factors you do have control over. Besides family history, diabetes, smoking, high blood pressure, and high cholesterol. So those are the big five. That doesn't mean that there aren't other risk factors, though, that are also under your control. And a lot of it has to do with lifestyle choices, either a choice to lead a sedentary lifestyle or other recreational activities such as excessive alcohol consumption or recreational drug use. Those are the things that you do have a choice over and that you can control.
Well, I would assume that some of those symptoms of a stroke would be very varied. You know, my grandma, for instance, she found out she had a stroke because she went blind in one eye. So what are some of the symptoms of a stroke?
The most classic stroke symptoms are ones that are unilateral or one-sided. Anything that happens and has a sudden onset of something that's on one side of your body and not the other side. That might include a weakness, a numbness, a loss of coordination on one side or the other, a change in your face that's only on one half of your face and not the other, a change of your vision, again, that comes on suddenly on one side and not the other. But any other sudden change in how you're doing can be related to having a stroke, such as the sudden inability to speak, the sudden loss of balance or coordination where you suddenly cannot walk straight without falling down. Anything that comes on suddenly and affects the way that you're acting and moving and being able to function, that can mean a stroke.
Well, and I would imagine, too, that it's really important for you to get to the hospital or your doctor's office as soon as possible when these symptoms come on. I know some folks can be hard-headed and no, I'm okay, everything's okay, but like you said, it's a sudden situation and you may think maybe it will go away, but I imagine it's important to get in somewhere as soon as possible.
And that's what we're trying to get the word out to people, to treat stroke like the medical emergency it really is. And you wouldn't ignore the symptoms of a heart attack, so please don't ignore the symptoms of a stroke. Please do not just go to bed and think that you can sleep off your symptoms, because you will not. You must call 911. Don't go back to bed. Don't phone a friend. Don't even call your doctor's office. We want you to call 911 and treat it like the medical emergency that it really is. And through trying to get this word out, to try and encourage people to treat it seriously, to try and lessen stroke's impact on the quality of your life, that is the big push through the American Stroke Association to get the word out through public service programs such as this program. So thank you for contributing this way, to try and get the word out to people to treat it like a medical emergency. And part of the American Stroke Association's push for that is trying to educate people on what to look for in their loved ones and friends in case they might be having a stroke. The American Stroke Association likes to use the acronym FAST. That's F-A-S-T.
Well, that's easy.
It is
hopefully.
easy to remember. FAST. F is for face. You ask the person to smile at you, and you see, is one side drooping down? Does one side of their face not move? A is for arms. Ask them to hold up both of their arms and hold it there. Are they able to do it, or does one drop down? And then S is for speech. Ask them to say something. Can they get their words out, or is it slurred? And then T is for time. And that's a reminder for you to call 911 immediately and don't wait.
So the first step is, if you have symptoms of a stroke, is to call 911. Great. Well, how can we prevent a stroke? Is it preventable?
Yes, actually it is preventable. And through education programs like this and trying to get the word out on how to prevent stroke or how to get timely treatment for a stroke, the good news that I wanted to tell you is that stroke had been the third most common leading cause of death in the United States. But thanks to programs like this, thanks to education, thanks to increasing awareness of stroke, a couple years ago, stroke actually fell to fourth most common cause of death in America. And it's through encouraging people to educate themselves on what their stroke risk factors are. Now, firstly, that would mean taking control of your medical conditions, trying to take prescription medicines to control the problems, all the risk factors that I just said that would cause you to have a stroke. Now, most people who want to prevent a stroke, they may get started on a baby aspirin every day, and that is first-line treatment to try and prevent. But what's even more important than that is controlling the reasons for why you had a stroke in the first place, or controlling your reasons for being at risk. Because if you don't control diabetes, high blood pressure, high cholesterol, then there's only just so much that aspirin's going to do for you.
Well, as we're wrapping up, can you tell us if someone has questions or maybe something about their health is concerning to them, how can they get a hold of you?
Well, online, they can go to baptistmedicalgroup.org, and if they want to educate themselves more about their stroke risk factors, you can go to the American Stroke Association website. That would be strokeawareness.org, and online they have stroke risk factor quizzes that look like this.
Nobody likes quizzes, though.
This is a
for your health.
This is a fun and easy quiz that they can go online, strokeawareness.org, to educate yourself about your risk factors and about what you can do to try and prevent you or your loved ones from having a stroke.
That's so important. And again, we so appreciate you being here this morning. Thank you so much for joining us.
Thank you for having me, Rachel.